All right, I think we can go ahead and get started. So, hi everyone. Thanks for joining us for the final session of our space medicine elective. We all enjoyed having you here, and we hope you enjoyed it as much as we did. Um, we did make a very brief post-elective survey. It would be a tremendous help if you could fill it out. It's just a few questions to help us gauge how helpful the elective was and to get some feedback. I'll drop the link in the chat after Dr. Buckey's lecture during questions, so it isn't distracting. Just wanted to mention it now. So today, Dr. Buckey will be discussing the challenges that commercial spaceflight passengers face as that sector continues to grow and space tourism becomes more and more of a reality. Dr. Buckey, the floor is yours.
Okay, great. Thank you. I'm unmuted, so that's good, right? Oh, could you enable screen sharing?
Yes, let me do that.
Okay, so today we're going to talk a little bit about some of the special problems presented by commercial spaceflight. And it's happening, which is kind of exciting to see that we're now having people who are, not career astronauts are going up into space more frequently, and it's only going to become more common in the future. So certainly an interesting topic, and certainly where the field is heading. So if we go back to 1968, I mean, this is how it was envisioned that commercial spaceflight would be circa 2001. So we haven't quite reached that, but we can get some idea about what commercial spaceflight will be like just looking at regular airline travel. So before we talk about special things that happen in weightlessness, what are some of the things that just happen to people who are traveling just in airlines right now, because those are things that are going to happen in space as well. And this was a study that was done just looking at one airline's experience over 12 months. It's from a little while ago, but I don't think it's changed that much as what has happened. So over that time, there are about over 2,000 in-flight medical incidents. 181 diversions for a medical reason, 7 in-flight deaths. I mean, there have been times when they've had the pilot die on a flight, and the airline flew over 100 million passengers, so it had quite a lot of people who flew on airplanes. So these sort of things are going to happen. I don't know if any of you have been called upon to deal with an in-flight medical incident. It's happened to me twice. And it's always very interesting to open that airline medical kit and figure out what they have in there. But common things are common. And one of the most common things, at least a common cause of death among people who are middle-aged, is cardiovascular disease. And this hasn't been a stranger to the space program either. And these are this is a little quote from the biomedical results of Apollo. And if any of you go back and look at what happened in the Apollo 15 mission, they have tracings in there that you can see that one of the crew members had bigeminy. He had this sustained run of ventricular bigeminy while in the flight. And what it said here, it must be noted that one of the Apollo 15 crew members who experienced a cardiac arrhythmia had undetected coronary artery disease at the time of the mission. Approximately 2 years after the spaceflight, this particular astronaut suffered an acute myocardial infarction from which he completely recovered. The undetected coronary artery disease almost certainly interacted negatively with potassium deficiency and fatigue to precipitate the in-flight bigeminal arrhythmia experienced by this astronaut. But it's just a note that cardiovascular disease is common, not depending on how much you screen people. You're still going to have cardiovascular events. And even today with screening and all the rest, a lot of times that people first know that they have cardiovascular disease is they die. So sudden death is often one of the prime presentations of underlying coronary artery disease. So that is definitely going to be an issue. And it's certainly dealt with a lot more aggressively than it has been in the past. And we all know that there are defibrillators everywhere these days. But that's going to be something that, depends, particularly as you get older people and do less screening, you're much more likely to have people who are likely to have some sort of heart problem. So the other thing too that we tend to forget about with it's a medical problem, but it's more of a behavioral health problem, is that you're going to have a whole wide range of people with different experiences with anxiety, depression, personality disorders. And this is a little clip from the New York Times back from 1996 about, again, from the airlines. It said the aviation agency said it had received 96 reports of passenger interference with crews in 1993, 194, 94, and 174 last year. Last year, an investment banker urinated on a food cart after flight attendants refused to serve him more wine aboard a United Airlines flight. He was placed on 2 years probation and fined $5,000. So again, as screening becomes more lax and more people are allowed to fly, it's certainly going to be the case that there'll be more of these sort of behavioral events where there'll be interactions of the people on board the space flight with the crew. This is a recent event. I'm sure you remember, I heard about this one. This was a person who ended up being taped to the seat on an airline flight because he was being so disruptive. And so this is another class of events that you might expect could occur on commercial space flights. So when we think about what can happen aside from these things that happen with airlines and happen here on Earth, special things related to spaceflight could be problems caused by weightlessness, so special physiological events that occur in space, problems during reentry, either during head to foot or front to back acceleration, depending on the kind of spacecraft you're talking about. Potential problems caused by malfunctions, like loss of cabin pressure, emergency egress, all the sort of things you go through before you take off on a airline flight to make sure you know how to use the oxygen mask and things like that. And problems caused by anxiety and personality issues. So these are some different areas that you might expect could come up on commercial space flights or any space flight, but particularly here where you're not going to screen people as extensively as is done currently for astronauts. So let's talk about some weightless issues. Here's a case study. It says, Mr. X has had high blood pressure for a long time. He gets a little short of breath when he lies flat, but the feeling goes away if he sleeps with his head propped up with a couple of pillows. Though he can't do what he used to, he's working and doing fine. Flying in space has been a dream of his, should he go into weightlessness. So what I'm kind of presenting here is someone who maybe has a little bit of congestive heart failure, maybe a little bit of diastolic dysfunction, and gets a little short of breath lying down, or when they gets a little fluid overloaded. So we know that there is a fluid shift in weightlessness, right? We see that leg volume decreases by about 1 liter per leg, so that's a lot. Forehead tissue thickness increases, and that's part of what underlies the puffy face that people experience. Pulmonary capillary blood volume increases by about 25%, so that's showing that there's more blood volume in the lungs. Intraocular pressure increases, although I have to say over time it goes down, and so that probably by the time you adapt to weightlessness, it's actually at about the seated level here on Earth. And stroke volume increases. Again, this is acutely. Over time, it does start to come back towards a value that's between this standing and supine value. So these are all things that happen, and of course we think about a fluid shift raising pressures in the chest. It would raise pressure outside the heart, like central venous pressure, right atrial pressure, and then this in turn would lead to an increase in stroke volume. But as we went through earlier in the course, that's not actually what happens in space. So on this graph on the right here, and this is back for some work that we did earlier in the space program. This shows supine here and then in flight, and the triangle is central venous pressure, which goes down from the supine value, but the little squares here show stroke volume, or in this case, LVIDD, which is the diameter of the left ventricle, goes up. So even though central venous pressure is going down, heart size is getting bigger. And so that seems like a paradox. It seems like that shouldn't happen. That's not our experience with what happens here in 1G. And so what might be going on can be seen on this picture. I'd like to thank Mimi Land for putting together this graphic. I think what we tend to think about is going from standing in 1G and then going into 0G, and that causes fluid to move from the legs and into the chest. And that's one way of thinking about it. But another way of thinking about it is, instead of starting with the standing position, if you start out with the person lying down where they've already had a fluid shift into their chest, here on Earth, lying supine, they have gravity creating some weight from tissue. And when they go into weightlessness, the weight of that tissue is removed. So any tissue compression forces they might have, the hydrostatic gradients that we talked about earlier in the course are gone. And so as a result, they're probably able to accommodate the volume of blood that they have at a lower pressure. So even though pressure goes down, the volume is, at least in the heart, is increased because it's able to expand more easily. So that's something that's unique to weightlessness, and something we have to take into account when we think about how will people with different medical conditions adapt to weightlessness. And also, we tend to always think of weightlessness as, causing physiological problems, but not necessarily everything that happens in weightlessness is necessarily a problem. So it actually can cause some things to work a little better. So here on this graph on the right here, this x-axis is time in days, and this little box here is weightlessness in 0G. And then on the y-axis here, we have the percentage of pre-flight standing of the membrane diffusing capacity, or how well does oxygen diffuse in and carbon dioxide diffuse out of your lung. And what you can see is, compared to both standing, which is this triangle, and supine, which is this upside down triangle, compared to both of those, it's better in weightlessness. And one possibility is that when you are in weightlessness, there's a very even distribution of the fluid in the lung and the air in the lung. You don't have any hydrostatic gradients that are causing a mismatch between the ventilation and perfusion. But it also may be that with the loss of tissue weight and the loss of the hydrostatic gradients within tissue, you may have more open capillaries. And so as a result, you might be able to do better gas exchange in weightlessness than you do here on Earth. And you wonder, well, could this be expanded to other areas too? So if this is happening in the lungs, what about in the rest of the body? And so what I was going to show you is some results from parabolic flight. And here's one way to what we're going to be looking for in this data. So let's say you were to go from standing up and lying down. So you went standing up and you lay down, and so you had a fluid shift into your chest. What would happen is that your central venous pressure would go up, your stroke volume would increase. That would every time you have your heart would beat, that would cause a little bit of an increase in your blood pressure. Your baroreceptors would sense that, and there would be a reflex to slow down your heart and dilate your blood vessels. And so how would you know if your blood vessels were dilating? And one way to do that is by using a technique called muscle sympathetic nerve activity. And what that is, it's the nerve traffic that are going to blood vessels in the muscles in your legs. So you might expect that if you were to lie down, increase your stroke volume, stimulate your baroreceptors, and reflexly dilate your blood vessels, you would see sympathetic nerve activity go down, right? Because that nerve activity wants blood vessels to constrict. Instead, when you lie down like that, it wants them to open up. So sympathetic nerve activity goes down. So the question is, what happens in weightlessness? If weightlessness is like going from being supine to being head down. We might expect more fluid to shift into the upper body. We might expect stroke volume to increase more, for there to be a little increase in blood pressure, and we would expect sympathetic nerve activity to go down. If, however, weightlessness is having an effect on blood vessels independently, we might expect for blood vessels, perhaps, maybe like what's happening in the lung, to open up, which would be a stimulus to reduce blood pressure, and we would see sympathetic nerve activity go up. So that's so which one of those happens? Well, what we did is, and by we, I mean Mimi Land, who's on this call, and also Chad from an undergrad here at Dartmouth. And so we looked at a study that was done by Awasi et al., where they measured blood pressure and sympathetic nerve activity during a parabolic flight. And so on the left panel is blood pressure, and this is repeated parabolas. So this is one person measured repeatedly, and this is when in the aircraft you go to 2G, and then at 0G here, and then back to in this case 2G again. And then they also measured sympathetic nerve activity, which is this activity here, and again from 2G to weightlessness. And so it's a little hard to read just looking at these particular graphs here. So what we did is we put these data together. And if you do that, this is the sum of all those blood pressure readings. And this is what the sympathetic nerve activity looked like. And what we're seeing is that as the person enters the parabola, over a very short period of time, blood pressure starts to drop and sympathetic nerve activity comes up. So at least from this one study, there's a suggestion that what's happening is not what happens when you go from being supine to lying head down, or from standing up to going supine. Instead, there seems to be something else going on in weightlessness, perhaps a dilation of blood vessels. So anyway, so what's a little summary about the fluid shift? That entry to weightlessness produces a fluid shift, but important, that's not the only thing that's going on. There's also all this removal of the hydrostatic gradients and tissue weight. And it's really not clear if this fluid shift is more pronounced than the fluid shift that occurs from going to standing to supine. So that's not really clear, at least to me. And there's really no data to tell whether individuals with clinically unapparent diastolic dysfunction might have problems in weightlessness. So if somebody who had some reduction in heart function and they had this fluid shift, would they have a problem? Or maybe it would be beneficial. Maybe they're experiencing some vasodilation. So another very interesting area of research to figure out what's going to happen to people who have some sort of cardiovascular disease and they go into space. The fluid shift also affects eye pressure and intracranial pressure, but we talked about that early on. So this is one area, this cardiovascular adaptation, that's an important consideration for sending people who are not as well screened into weightlessness. Of course, the other big thing is motion sickness, and I showed this picture before, is that being in weightlessness, it's an altered motion environment, and just like going sailing or being in the back seat of a car or whatever, it makes people susceptible to motion sickness. And so that raises the possibility of using drugs. And I wanted to show you this because what this is from is, this was a study that was done some time ago in 1968 by Wood and Graybiel. And I don't know if you remember, but during the lecture on artificial gravity, I showed you that slowly rotating room, which was in the Ashton Graybiel laboratory at Brandeis. And of course, it's named after Graybiel, who did this work. And he did this work actually in a slow rotating room. How they did this study is they had people who were in the slow rotating room, and what he had them do is they had to turn various dials, which were located around them. And then every time they moved their head out of the plane of rotation of the room, they get that spinning feeling. And then of course, over time would make them motion sick. So So this was Gray Beal back in 1968, using the slow rotating room to evaluate a bunch of different motion sickness drugs. And what you can see, just in general, they looked at a lot of different amphetamines, and bonine is meclizine, so you may be familiar with that. And Dramamine, of course, is the diphenhydronate, very common drug there. And so these are all sort of classified here. And then when we get into this area here, we start getting into promethazine, which is the one that's given a lot in the space program by injection. And then when we get to scopolamine and amphetamine, that's the combination that turned out to be the best, at least in this study. And this was the combination that early on was used in the space program and used to be used a lot in the parabolic flight program at NASA. So scopolamine, it's been around for quite a while, which I'll show you, but it also is an effective motion sickness medication. It's something that we've done some work with here in the lab because we're interested in finding ways to give people motion sickness relief without necessarily giving them an injection. And the reason for that is that if you've seen recent SpaceX flights, when you go into space on a SpaceX flight, you're wearing a suit. And so it's a little hard to give somebody an injection through their suit. Although for those of you interested in history, the Gemini suit did have a little area where you could put in an injection. Same thing when you return and you're in a capsule in the water that's going up and down with the waves, it's hard to give somebody an injection in that environment. So the thing we've been interested in is giving these motion sickness remedies through the nose. And early on, we studied a gel formulation and found that although it did get in the body, it didn't get in very quickly, because what we want is something that's going to get in like that and can give you relief right away. So instead, what we've been working with is scopolamine given nebulized into the nose. So it's a fine mist into the nose of aqueous scopolamine. And we were just this year, as a matter of fact, we were able to do a couple of people using this formulation. And what you can see here, this is time on the x-axis. So, and the gray dots are the study we had done in the past with the gel formulation. And then the red dots are the two people we were able to do so far with the nebulized formulation. And you can see, at least for this person, it got in really fast and they got a really good concentration in pretty soon. So we're hopeful that this might be a way to help deal with some of the motion sickness, when somebody needs relief right away, right now, and it's not very convenient to give them an injection. I think scopolamine is a great motion sickness medication. You do have to remember, as is true with all motion sickness medications, they have side effects. This is a historical note here from 1907. Hyoscine and hyoscine is next to scopolamine, are very powerful alkaloids that should always be used with great caution. Hyoscine is the less dangerous of the two. Both are used as hypnotics to a considerable extent, and especially in hospitals for the insane. So they've been used a lot in the past, and it's this sedation that they're talking about here is dose dependent. So you do have to dose scopolamine appropriately, not to give too much, because it makes people drowsy. It also affects their accommodation. And with all of these motion sick, well, particularly the promethazine and the scopolamine drugs, you can create urinary retention, as we talked about earlier. That has happened. One other area we actually talked about this earlier was orthostatic intolerance, being unable to tolerate the upright position as well as you could before you left. This is Gordon Cooper after his flight. And you notice they're kind of holding on to him after he came out of his Mercury capsule. And a little while later, this is how they described his situation. They said, after standing on the deck for approximately 1 minute, the pilot began to look pale, and although his face was already wet, new beads of perspiration appeared on his forehead. He swayed slightly and reported symptoms of impending loss of consciousness, including lightheadedness, dimming of vision, and tingling of his feet and legs. And so what he was experiencing was post-flight orthostatic intolerance. And a lot of reasons for it. Partly is due to the reduction in blood volume that you have when you're in space. Also, probably is pretty hot being in that capsule during recovery, and that probably didn't help to reduce blood volume even further. So orthostatic tolerance is an issue. It has been an issue in the shuttle program. Now, in the shuttle program, remember, when you're re-entering, you're experiencing head to foot G forces, or GZ. And these are a couple of tracings from studies I was involved in of people's heart rate during re-entry in the shuttle program. And you can see here, and this, so this is time here on the x-axis in minutes. And then the black line is the G profile. So during shuttle re-entry, it went from 0 up to about, in this case, it's about 1.6 G, and then it comes down to 1 G. And you can see this person's got up to around 150 beats per minute in the shuttle. This person actually had a vasovagal episode. That's I don't know if you've ever experienced that, but they look at the sudden drop in heart rate, suggesting almost passing out. So that can happen, and that's only one kind of G-force that you can experience. This is a little headline I came across, which highlights the other kind of G issue that you can have. And the title is, Soyuz astronauts' emergency descent was a harrowing high G ordeal. And in this case, we're talking about GX, or front to back G forces. Usually on a reentry, this goes up maybe 3 or 4 G. But if there's a problem, you can get up to, in this case, they had like 7 to 8 Gs during reentry. And in some instances, it can go even higher. And so you can imagine that, so people who may have underlying cardiovascular disease, or people who are substantially overweight, 7 to 8 Gs front to back on their chest is going to give them a lot of trouble with breathing. And for those people who haven't experienced it, it might create a fair amount of anxiety. So just to summarize, for short duration flights, motion sickness and the effects of the fluid shift, the loss of tissue weight, are going to be those main space flight unique concerns just upon entering weightlessness. On the other end, you have to worry about orthostatic intolerance if you're doing an upright reentry, and then the possibility of a ballistic entry and creating a significant G challenge as you're coming back to Earth. And then, just like in passenger airline flights, eventually some in-flight events will occur, and they're going to run the gamut of the same kind of things that happen on airline flights are going to happen in space. Common things are common. And determining who should and shouldn't fly is really a work in progress. There's still a little bit of knowledge that needs to be gathered about the physiology. And just as more people fly and more experiences, more things happen, we'll get a better sense about what kind of things are okay for going to space with, and what kind of things might present a problem. So I'm going to go ahead and stop there, and happy to open it up.
Great. Thanks, Dr. Buckey. All right. So at this time, we'll open the floor to questions. We'll take questions until about 6:40, and then we'll let the student presenters take over. In the meantime, I'm going to drop the link to a survey in the chat. So it's just 1 to 2 minute survey, very quick, just to kind of assess what you thought about the elective and how helpful it was. So while we're taking questions, please feel free to fill that out.
I have a question. Why is it in the shuttle that it's more like GZ rather than GX? Like, is it the piloting position that causes that?
Yep. Yes, because you're in a seated position. You're in the seated position during reentry, and so as a result, just like when you're flying a fighter jet, you're seated and you pull G's, you get a head to foot G force. Same thing in the shuttle. As you're decelerating, as you re-enter and you're seated, you're going to get a head to foot G force. It's not that much. It goes up to about 1.6, 1.8 G, but it happens at a time when your ability to tolerate it is reduced.
That makes sense. Cool.
And then there are spacecraft being planned that will do this that you'll fly that way. And just to add into that, they did have, for people who had been long duration flyers, sometimes they would have them reentry supine on the shuttle rather than having them be seated. So just to help to avoid that problem during reentry.
I did wonder about that because I was like, well, only the pilot really needs to be like, or the pilot and the co-pilot probably need to be seated. The rest, maybe they can lay in the back and enjoy the ride in.
Exactly. And the launch and entry suit had a G suit incorporated into that you can pump up, and you could fluid load beforehand.
Anybody else have any questions? If not, that's okay. Don't feel pressure. All right. If not, we can go ahead and move on. So tonight we have Kakan Ahmad and Ella Collins are doing a joint presentation, both Dartmouth students. Kakan, I made you, yeah, sweet.
All righty. Thanks, Joe. Can everyone hear me? Okay. So today, Ella and I will be talking about the commercial side of what we've essentially been learning from Dr. Buckey over the past couple of weeks. There's been a huge advent of commercial spaceflight, and lots of very wealthy tourists are going up, and that number is expected to increase over the next couple of years. And they will be patients. They will experience adverse health effects, and we need to start thinking about how we can deal with some of the problems that might be coming down the line. So a brief overview of what we'll be talking about tonight. We'll start with a short history of commercial astronauts, follow that up with some of the safety considerations that we might need to think about for them. Then we'll do a bit of a scenario to see if you or I could actually go up into space, what kind of regulatory holes we would have to jump through, hoops. And then we'll present a couple examples of missions and the kind of medical requirements that they had. And lastly, we'll have a short discussion on some of the ethical implications of having very wealthy people pay to go up into space for fun. So a history of commercial astronauts. Interestingly, initially, the first couple of astronauts at the beginning of the 2000s went up using Russian Soyuz spacecrafts. There was a partnership that existed between the Russians and an American company called Space Adventures LLC that sent up their first space tourist in 2001, Dennis Tito, who actually docked with the International Space Station and spent a week up there. That was followed by Mark Shuttleworth in 2002. And there were plans for many more, but the program had to be halted in 2003 because of the shuttle disaster. And interestingly, the reason that the commercial program was paused is because NASA needed the Soyuz spacecrafts for their own purposes. The program resumed in 2005 with some notable tourists, including Anousheh Ansari, who was the first woman private astronaut. In 2009, the program came to an end because, once again, NASA needed the use of the Soyuz rockets. Now, in 2019, things are gearing up again because NASA issued a directive that essentially aims to create an economy in low Earth orbit. And the way that NASA hopes to do that is by establishing commercial activities with tourists who can actually go up and stay on the ISS for less than 30 days, as well as working with companies, especially in the industries related with manufacturing, regenerative medicine, and bioengineering. Since this new policy came out in 2019, there's been a sort of revitalization with 4 recent notable space flights that involve commercial tourists. The first 2 happened in July. These were suborbital missions that just went up for about 15, 20 minutes. The tourists got to feel some weightlessness, and then they came down. In late 2021, there was a mission through SpaceX where 4 private astronauts actually orbited the Earth in a Dragon space capsule and that was the first ever solo orbit by private astronauts. In April of 2022, we once again got the revisit of commercial tourists to the International Space Station when the Axiom 1 mission spent 16 days on the spaceship. So we've been talking a bunch about some of the safety considerations that we need to think about when it comes to actually spending time in microgravity. I'll run through these really briefly since we've talked about them a bunch, but there's some tension that we feel on the acceleration launch, like Dr. Buckey was just talking about. There is an adjustment period to microgravity that can often manifest in 2 to 3 days of vomiting and nausea, and there's fluid buildup as well. Similarly, there is loss of blood pressure that can manifest with orthostatic hypotension on return to Earth, as well as skeletal lengthening, which can be more of a problem in people with pre-existing conditions. Similarly, there is sleep discomfort, urinary retention, and some of the eye problems that we talked about earlier in the course. So all in all, lots of dangerous conditions that can have some really negative health impacts on people that are paying lots of money to go up for fun in many cases. And obviously, the health impacts vary by length of stay and how high you go up. So another important patient consideration is psychological. As professional astronauts train for many years, they know how to handle very difficult situations. A lot of that comes from the military background that many astronauts have, including Dr. Buckey. But in the private world, who knows who is the other person that's winning the lottery in the seat next to you? And you might not get along with the other people on your mission, especially when the amount of training that we'll talk about isn't really substantial. And there doesn't seem to be much of a focus, if at all, on the psychological aspects. Here is a summary. I won't go through this. And here's something that I mentioned already, but a huge consideration when it comes to commercial space flight is people pay millions of dollars for these very coveted seats. And if someone is paying $20 million to go up into orbit for, say, 7 days, it's not great that they're spending the first 3 vomiting and not having a great time. Similarly, they may be having urinary problems, and who knows if they're getting along with the people in their crew. So there are many problems that can manifest. Some of them do have to do with pre-existing conditions. And our role as, some of us as future space medicine physicians is to evaluate everyone for their preconditions, for their risks, and try to identify ways to mitigate those risks during the mission to prevent harm to the mission, as well as to other crew members. Importantly, there's in the literature, there is some sense that physicians don't necessarily make certification decisions. They're there to help their patients better adjust to the commercial spaceflight experience. So let's say you have $1 billion and you want to go to space. What kind of hoops would you have to jump through? Well, it depends. You have to make some decisions on you have to make some decisions on, first of all, how high up do you want to go? Are you looking for a few minutes of orbital lightweight? Or do you actually want to go into orbit? As well as, are you trying to do research? Or are you just trying to have fun? And most importantly, are you going to be visiting the International Space Station? As it turns out, visiting or using a NASA spacecraft has a huge impact on the kinds of regulatory hoops that you have to jump through before you can actually go up. So what we see is there are kind of 2 parallel paths that you can fall into as a space tourist. The first is if you are using non-NASA vehicles. So here is, for example, a quick 15-minute Blue Origin sojourn. Here, there are no specific medical requirements. you only need a few hours of safety training, and the company has a lot of leeway in whether or not they allow you up. Whereas if you are visiting the International Space Station or docking with a NASA spacecraft, you will be under the purview of NASA. So that requires much more stringent health requirements, such as a complete blood count, a metabolic panel, a urine blood test, all of that. And your medical requirements are closer on par to professional astronauts. So our first case example is that of the shorter Blue Origin mission that Bezos did with his brother, and an 18-year-old kid, as well as Wally Funk, this 82-year-old aviator. And for them, they only did 14 hours of training by Blue Origin. It was not overseen by NASA, and they had no medical requirements. Now, compare that with the Axiom 1 mission, which earlier this year, four of these guys went up and spent nearly 2 weeks in space at the International Space Station. They had to undergo training through NASA to meet all those certifications. So instead of just 14 hours, they spent nearly 10 months in Houston working with NASA and undergoing their required training. Now, interestingly, Inspiration 4, which was the solo private orbit that I talked about earlier, they did not undergo NASA training because they never docked with the International Space Station. They didn't use any NASA spacecraft. So SpaceX had a lot of leeway in what they could do. And with that, I will turn it over to Ella to talk about some of the ethical implications of sending billionaires up.
Okay, so to finish it off, we'll kind of change gears a little bit and leave you all with some philosophical questions to ponder yourself. I think as much as I am always really excited to learn about the kind of the space medicine aspect of it, I also feel like it's important to think about these sort of things. So I think the first question that I put on here is broad and complex, and it doesn't have a yes or no answer. I think that it's important to acknowledge its complexity and think about kind of the different ways to answer that. Space exploration has obviously historically been something that's benefited humanity in so many ways, advancements in technology, and like so many examples we've talked about with Dr. Buckey in medical care too. I think at the same time, there's a climate crisis, several different social crises, an ongoing pandemic. And I think all of these things would also benefit from the same sort of investment and innovation that's being that while commercial spaceflight does have so many benefits, it's not necessarily impacting or benefiting the present outcomes of people across the world right now. With that said, I think the second, the fact that commercial spaceflight does already exist, resources and money and innovation is already being invested in it. So I think what's most important now is that we think really deeply about the sum of the potential impacts of commercial spaceflight. So the positive ones, the negative ones, and the neutral ones, and the impacts that a complex industry like commercial spaceflight may have, and really investing time in developing and understanding clear principles of space ethics, and using those principles to create laws or regulations to help reduce some of the potential harms, and ensure that commercial spaceflight is something that's safe, sustainable, practical, and peaceful. And that's all I have. I would love to hear people's thoughts about these questions or anything else that Khan shared.
I would love to get Dr. Buckey's take on what some of the regulations should exist out there. So as I kind of touched on in the presentation, there's a big dichotomy between NASA regulations and what everyday companies are allowing, or the practices that they have for their paying customers. Should those NASA requirements be standardized across everybody? Yeah, do you have thoughts on that?
Yeah, so I think the goal, I think, with the FAA and others has been to try to not to stifle the growth of the commercial space industry. So as a result, they've had a fairly light touch to regulation. Where this all where this all will get its test is when you have the first dramatic fatality, and then then there'll be a major rethink about what's appropriate and what's not, what's a reasonable risk and what's not. Right now, yeah, right. It's somebody just said it's 100%. No one goes to space, the safety is 100%, right? So it is inherently unsafe, at least at the moment. So there's going to be there are going to be problems happening. I mean, the key thing, of course, is not to have the rockets and stuff hit inhabited areas and things like that. So, so there's all the regulations that go around launching rockets are extremely important. As far as, what happens when we have the first, off nominal reentry and people get killed, or, there's a loss of cabin pressure, and people, how the reaction is going to be to that, I don't really know. I think right now it's going on the idea that people are giving this, they're consenting, understanding the risks that they're undertaking. I would like to see a registry done. I would like to see everybody doing the same set of measurements. And, I would like to see kind of a nice tracking of everybody who goes into space and what they have, because that's the only way you're going to figure out about what unique conditions and physiological things are important, which ones aren't. So but overall, I mean, the thing is, I'm excited about it because it's the space program for too long has been just government financed low Earth orbit missions, and it's really kind of about time the technology is there to move towards other things, and the cost has got to come down, and it is. So even though it's just billionaires right now, before now is nobody else. So it's going to fall from billionaires to millionaires to other people. So over time, I don't know if that was really an answer.
Yeah,
more of a ramble.
No, I think that hits the nail on the head. It's amazing. It's almost like you've done this stuff before, because one of the papers that we looked into actually talked about how the light touch that you mentioned that the FAA has right now is actually really good, because especially for the really short suborbital missions, you'll get a really wide variety of people that are going on the 15-20 minute flights. And if we are able to accurately track the data on those people, it would give us huge insights into what people with health risks might experience when they enter weightlessness. So I just don't know if there's a system that exists to do that yet.
Yeah. And some interesting things in the chat too here about the UK has a space act. Yeah.
And we have some hands raised, so I'll turn it over to Matt if you have a question.
Hello, thank you so much. I just had a quick question regarding the effects of, we were talking about how the difference in commercial missions, some of them reaching the International Space Station versus for like a 15-20 minute low Earth orbit mission. And I had a question if there's been any instances or any insight to how a long duration crew would react when you have an outsider who comes into their crew for like a short 7-day mission, and how that would kind of impact the research that they do and the overall goals of that mission, whether it would be a positive or a negative, or if a negative, like how negative, if there has been any instances in the past.
Yeah. I will turn that one over to Dr. Buckey, because I would also love to know, if you're an astronaut and this rich dude shows up and says, I'm going to hang out for 7 days, how do you react to that?
Yeah, so this has been experienced. This has been experienced on the space station because even without commercial space flight, there were people who are long-term on the space station who were then visited by short-term shuttle crews. So that before the shuttle went out of service. And it it varied. A lot of times people were excited to have new people on board, but also a lot of times it was disruptive, because they felt like they had this nice, they had a kind of a routine set up and they had these relationships set up. And then all of a sudden these people are, coming and, it kind of, and so sometimes it was disruptive. Other times it was seen as being, fun. You could certainly see how this would also be very specific to the person, I'm sure you could think of people that you'd really love to spend a week in space with. And I'm sure you can think of other people who you would really hate to have to spend a week in space with, and that's part of the selection process, but if you're not selecting people, it's going to be the luck of the draw. The people may end up with somebody who's a real pain, who's, is going to be there for a week. And as we talked earlier in the course, is that these psychological issues are often underappreciated. So, because that can have a big impact.
Thank you.
Colton.
What's up, guys? Thank you again for another great presentation. Not to get all sci-fi on everybody, but I was just wondering, as far as like the societal ethical implications, at what point do we kind of look past game one and look at the playoffs and say, like, as a society, are we trying to push this to like different planets? Probably a little bit early in that process, but eventually I think we're kind of ambitious creatures and we want to eventually, 1,000 years from now, like I said, a little bit of sci-fi, but kind of want to be moving around, Elon Musk, get on Mars and stuff like that. So I think it's kind of natural that we try to figure out how to get billionaires now, millionaires later, than the everyday person kind of moving around. Wondering if anyone else has thoughts on that. Should we go to a different planet as a society?
Well, I'll jump in. I mean, I think we're at a very exciting time, right? Because up until recently, it was, so the shuttle was reusable, yes. But, when the shuttle was designed, it was supposed to be flying like every 2 weeks, and it was going to be this quick turnaround, super low way to get into Earth orbit. That didn't happen at all. But now it's different. We're already seeing with like the Falcon 9. I mean, those things are getting reused multiple times. It's really, and then if the Starship happens, it's really going to drive down the number one barrier, which is cost of getting into orbit. Because that's what's really the number one barrier to exploration of any place. I mean, the most of the energy expended on going to Mars is getting from Earth to Earth orbit. Once you've done that, you're almost there, right? In terms of the amount of velocity you need, so we guess we didn't do that part of this in this course, but yes, it's most of the effort is just getting off the Earth. Once you're off the Earth, then you're good. And if you're throwing away the rocket every time you do that, that's kind of not an economically good way to promote space exploration, So now we seem to be moving into an era where that's not true anymore, which should really open things up.
And I think Gufran.
Yeah, hi. Yeah, thanks. So talking about some of the potential kind of ethical problems and the environmental stuff, I think this and sort of the idea that, like, I mean, I understand the reason behind sort of suggesting that we need to sort of think deeply about these things, but I think it kind of assumes that you can kind of think deeply sort of beforehand and figure out the problems before the thing actually happens. There's a great quote from Winston Churchill once about America, saying about, like, the Americans, they always do the right thing after exhausting every other possibility. Well, I think the same is also often true for humans, right? Like, so I think we'll figure it out, but like, it won't be, a lot of these things, you'll just need like more humans up there. Once you have more humans up there, there'll be more problems. And then we'll actually be motivated to like fix like those problems. And I think that's sort of the way that you figure it out, rather than the idea that sort of a priori you can just sort of figure it out in your head if we're just smart enough. Like some things you just have to try, I think.
Yeah, I think you're right. Yeah, you just we're gonna, yes, I mean, we wouldn't be here if we hadn't done all the previous work. Another way of looking at it, I mean, one example is often people, if you look at the iPhone, and but just it's this thing we hold in our pocket, but I mean the computer chips that get started, they all got started in the space program, and also with a lot of military spending too, I have to say. But and then the same thing for the satellite, so the reason you can use the maps function and all the rest because of GPS satellites, which is all an outgrowth of the space program, and military spending too. So but I mean, do we take that stuff for granted? It's now part of the economy. You don't really think about it, but we're using space every day, and we're you're using the dividends of that government investment from 50, 60 years ago. And even though I like to say it's from NASA, a lot of it was from the military too. So but anyway, but that investment is now something that we're really we use all the time, and it also it has a benefit, if you want to think nationally, that the country that does that is able to capitalize on that experience and on that technology sooner and better. So it's an economic boon, but it doesn't pay off right away, and it's not predictable. So you can't predict. You could say, oh, because we did this amazing thing, we're going to have that other thing later on. Well, I don't, you just really can't predict where it's going to go, and not everything is going to be useful, but I mean, but you have to sort of have faith based on what's happened in the past, that if you do it and you do keep after it and you invest in it and you are serious about it, that you're going to create some things that are going to be useful. But for a lot of times it's not a very compelling argument in the here and now, but if you look at it in the broader scope of things, we've benefited tremendously from the investments that we made, even though at the time that people were making those investments, they weren't envisioning that we would have a handheld device that we would use to help navigate our car. That's not what they were thinking.
I just had one last question, really going off of what Gufran was saying. And you mentioned military spending. I'm wondering if this is something that I've just thought about. I don't. How do we inspire, I guess, a national conversation? I think a lot of young people do look at things like SpaceX and think that, oh, that's very cool, but there isn't the policy backing to where the kind of military investments or investments in NASA are happening that you're talking about. So is there a way that we can make that happen to get more public investments into these programs that we know might pay dividends down the line?
Well, I think it's, the case, I think everybody should have seen by now that it's very important to vote and be politically active. And I think politics has gotten a bad name. When people say politics, they say, oh, it's just politics, implying that politics is bad. But the good side of politics is that politics is how we solve problems together, right? It's how we weigh competing interests, how we make decisions and take one path over another. So, and to not participate in that means that you're basically abdicating that to other people who are taking involvement in it. So, I think the key thing is the next time you get the opportunity to write to your representative, you do that and let them know that you're interested in this sort of thing. When an election's coming up, you can actually organize a group of people that and have candidates come and talk to you and let them know that this is an issue that's important to you and that people vote upon this issue. Most of the time, candidates, it's not that they don't care or are interested, they just think no one else is interested, right? right? I think of as a group, I would say people involved in science, engineering, and less so medicine are often invisible in the political sphere. They don't show up at meetings, they don't write letters, they don't, and so as a result, if you're in politics, you that people don't care. This just isn't a priority for them. So, but it requires work to do that. But if you make it just part of your life, that I'm a citizen, meaning that I have to participate in this and I need to go to this meeting, no matter how boring it's going to be, that is politics. It's not, crazy tweets. It's not, acting out or whatever. It's showing up at the routine meetings. It's writing in, it's voting and stuff, contributing. Those are all the very important things. And because without it, nothing happens. Because it's not really the politician's fault that they don't care if no one has even asked them the question. and I've had that experience several times, being the only one who's asked, that, oh, that's the first time someone's asked me about that. Well, that's not good. Oh, cool things in the chat here. Oh, yeah, right. I wanted to share one thing. What did I want to share? Oh, yeah. Here's a fun fact. This is one last thing. Oh, gosh. Anyway, let's see if I can find it real quick. Well, anyway, I don't have the quote in front of you, but I mean, how many people think the Apollo missions to the moon were worthwhile? Well, it's not good to ask in this crowd because you would show up for something like this if you didn't think so. But anyway, if you ask a lot of people that, they'll go. I mean, if you look at year 2000 retrospectives, everybody had pictures of the moon landing, right? You still use pictures of the moon landing today, in ads and stuff, right? Everybody thinks, oh, that was a great thing. They did a poll in July of 1969, which is the Harris poll, asking people how many people supported the missions to the moon. It was barely 50%. So in retrospect, we're all going, oh, that was amazing. Obviously, that was one of the greatest triumphs in the 20th century. At the time, it had bare majority support. That was the year that the moon landing occurred. So it's important to keep in mind that our ability to judge things in the moment is not always great.
Yeah, another great example of that is Jules Verne in the 1800s, when he was first publishing the De la Terre a la Lune. It was the first book that mentioned a journey to the moon or any kind of voyage to the moon, and he received a lot of public scolding for that. And he was made fun of for it, but here we are.
Wow.
All right, everyone. So thank you, Dr. Buckey. This was a great time, and I really enjoyed participating in these sessions, and I'm sure everyone else here did as well. So thank you very much for taking time to talk with us.
Well, to you and to Simran for organizing this. Thank you very much. It wouldn't have happened without you all.
But yeah, I'll keep in touch with everyone over email, and I'll send out that survey a few more times. I'll keep pestering a little bit, but other than that, thank you all for joining us. This wouldn't have been possible without your interest. So thank you all, and wish you all the best in your future endeavors.
Yeah, thank you all for setting this up.
Thank you.
Thank you, everyone.